I'm now going to show you how I bandage a knee with the Mobiderm using the 3-layered bandaging technique. So the first layer will be our cotton short stretch bandage, followed by our Mobiderm 15mm by 15mm, and we're going to fix it in place with the bioflexible tape. So we're starting with the cotton stretch bandage. This is 100% Egyptian cotton. It's basically like a tube, so we're using it as a double layer bandage. When we apply it, we're going to apply it with a 50% overlap. So basically start with your towel, you're about mid-shin level, and then from here we're going to work out with just a firm technique once you get that towel held in place with a 50% overlap. Now you can get a bit bunchy around the knee, don't worry about that too much. Just try and maintain that 50% overlap as best you can. Once you're getting up towards that sort of mid-thigh, you can sort of leave that towel sort of sitting. Don't worry about tucking that away yet. Next we apply the Mobiderm. So this is the 15mm cube Mobiderm. It comes in a 3 metre length and it's about 10 centimetres wide. So you're going directly over where you've placed the bandage. And as I said, you've got minimal overlap now. You're just doing enough to make sure there's no gaps. Remember, this technique in the Mobiderm works on the shear effect. So we want the ability for the skin, so the dermis to move, mobilise, so Mobiderm should enable that lymphatic system to work as best it can. So from here you can just sort of tuck that in there. You can tuck that cotton bandage in there. From here we're going over with the Flexidor elastic bandage to hold it in place. This is a compressive bandage. Again, we're going to be going over by about 50% overlap. So tuck your towel out the way, come round, and we're going to use what we call a tug and wrap technique. So you're tugging quite firmly down, you're maintaining that tension, and you wrap it round. And then tug again, and wrap. Tug and wrap. So keeping that tension on in between. Tug and wrap. Tug. You get that final bit in. And from there you can just fix it off with the bandage, little anchors. Now that's in place, the client can move that knee, so they can bend that quite up quite comfortably, or they can straighten it down.